in the lab and we can grow it to see if anything grows, okay? You do not want the slough. You are actually looking for an area in the wound that is that red beefy tissue, because that is going to provide a better sample of what's going on in the wound than the slough. Okay? So you're not taking it from a necrotic area, you're not taking it from a sloughy area. You are going to try to find a portion of the wound that is red looking and take some of the drainage from there. And the very best kind of specimen to get of those is for the physician to actually take a needle and aspirate out of the bottom of the wound. That is not something the nurses do. Okay? Now quickly, I'm just going to show you a few drains. You'll get to these more when you get to 102, the surgical course, but this is a Penrose drain. It's just a flat piece of rubber tubing that's sterile that gets put in the wound. And if a patient has a Penrose drain in, you're changing the dressing all the time, because the intent of it is that it's going to let that drainage that collects under the wound come out to the surface so we can get rid of it. These typically stay in a day or two. They do not stay in for very long. And they are usually not sutured in, so if it falls out, don't drop dead at the side of the bed. It's okay. Not a big deal. Linda reviews the nursing assessment and finds that Mr. Ahmad was admitted with a pressure ulcer. The ulcer is stage 2. It's 1 by 2 inches long and a 1/2 inch deep. We'll show you how to measure them in lab. Partial thickness wound over a sacral area. No necrotic tissue is present, and the wound bed has red moist tissue. That's a good thing, right? When Lydia prepares to conduct skin assessment, she recalls information about the pathogenesis of pressure ulcers and guidelines for skin assessment for patients with darkly pigmented skin. Okay, so she's going to have to go about staging this pressure ulcer. Linda observed care of a stage 4 pressure ulcer during an experience at an extended care facility. From that experience, she increased her knowledge about the debilitating effects of pressure ulcers. In addition, she was able to practice skin assessment technique during her clinical experience in the extended care facility. Okay? So, you know, looking at pictures is a good thing. Now, this is called a Jackson-Pratt drain.
This is one that I have.
Yeah. This is a little tube that gets put into the wound. It has a little bulb on the end of it, similar to a bulb syringe. And what you do is, it also has a little cap on the top. So you open the little cap, you dump the drainage out, and you compress the bulb and put the cap back on so that it is applying a little bit of suction all of the time. Okay? And eventually will suck that drainage out of the wound. Now, to measure that, I usually take a medicine cup, a plastic medicine cup with graduates on it, because there never is a lot in one of those. These are intended for small amounts of drainage. You're going to get, you know, 10 or 15 cc's in the beginning and then down to 2 or 3. You know, but that's what that is. There also is another type called a Hemovac, and I don't see a picture of that, but it's the same concept, except it's this little round disc about this big, and for that one, it's got an opening that you empty, and then you just push it together before you put the cap on it. It does the same thing. It expands this way and puts pressure, drainage pressure on it. This is the Culturette tubing I was talking about.
That red fluid that was in that last slide, that be called that sanguine?
Yeah. Yep, sanguinous, yes. Okay, so in the case study, you know, identify the source, the support surface that would be appropriate to increase the pressure on Mr. Ahmad's skin. So he cannot tolerate positions that might relieve or reduce pressure. Inspect and palpate the wound. We did that already, and you can see what she found about the wound. And she is going to conduct a calorie count, and he's eating fewer than 1,600 calories a day. Is that enough to be able to heal a wound?
No.
No, absolutely not. So, his major nursing diagnosis is going to be impaired skin integrity related to pressure over a bony prominence in the sacral region. We'll be talking about doing nursing diagnoses. I think we're just gonna skip through the rest of these, because these are kind of beyond where you are right now.
How many calories should you have?
Hmm?
How many calories?
Well, it depends upon what starting weight the patient's at and what we're trying to do. What should happen with this patient is there should be a consult with a nutritionist. Because that nutritionist can figure not only what calorie intake he should have, but can figure out how to get it into him without, if he's not eating well. And for example, we have powder supplements that we can add to juices and things that are protein supplements that will help a patient who's not taking adequate nutrition.
We have, excuse me, at work, at the assisted living place, we have what's called super cereal.
Yep.
They add certain stuff to it, like dried milk.
Yep.
Brown sugar, other stuff to the
Yep.
cereal. That
Absolutely.
increases the calories.
Absolutely. The nursing home I go to uses Mighty Shakes, and they are literally a full meal in a 6-ounce shake. And they come in vanilla, chocolate, and strawberry, and oh boy, do those fussy old ladies love them.
Oh, yeah, they do.
Absolutely love them. And, you know, so if they don't eat well, they get one of those. And if they eat well, they still get one in between meals. Because even though they're eating well for them, they probably are not getting adequate nutrition. So there's all kinds of stuff like that. And we're going to be talking about nutrition, how to feed those kinds of patients. Okay? So, quick quiz. Nursing assistant asks you the difference between a wound that heals by primary or secondary intention. You reply that a wound heals by primary intention when the skin edges are approximated. That's the term, approximated, they're together.
Migrate across the incision, that would be secondary now.
Yes. I'm going to, I think, skip the rest of these slides because we've talked about avoiding pressure points and things in lab. So let's go on to the next one. This is just an example of how they are irrigating the wound. You know, if you needed to get some of that slough off, that's another technique that can be used. That happens to be an angiocath that we would start an IV with on the end of that, but I've used just a plain syringe of saline, you know, and just squirted it on without the tip on it. That works pretty well.
And that removes that yellow.
That will help remove that yellow slough.
Yeah, the slough, not fatty tissue.
Nope, that's slough.
So that would be
That is slough.
2 or 3.
Can you just show?
This one is probably a 3.
Can you just show me the slough? Where the slough is?
Where the slough is, this yellowy stuff right here is slough. That's slough,
Okay, thank you.
okay? There's not a lot of fat at that part of the heel, you see? So that's slough. Let's see if there's any others you really need to look at here.
Dressing, transparent film dressing.
The dressings, we will talk about some of those in class, okay? Let me get to that slide, I'll just call your attention. Dry or moist gauze, we're going to show you today in lab this week how to do a wet to dry dressing. Not used a lot anymore, but you need to see how to do it. Film dressings are things called Tegaderm, that's the brand name, it's a clear film, you may have had an IV started. That often is what we use over the top of the IV so we can see the insertion site. You know, they are not good for this kind of a wound. They are not good for a pressure ulcer. Hydrocolloid protects the wound from surface contamination. It also has a substance in it that is going to become a gel as it is exposed to the liquid in the wound.
What one was this? The hydrogel?
Hydrocolloid. I
Hydrogel?
think if you look in your book, it describes them all for you better too. Hydrogel is going to also provide a moist surface to support wound healing. So in a wound that was kind of dry, that would be a good thing to use. Now, some of those dressings are also impregnated with silver. Silver is a good antimicrobial agent. So, for example, we have Aquacel AG, which is Aquacel with silver, that is a hydrocolloid that we would use for a wound. that we wanted to keep it moist but not wet. And that, without a wound vac, is just enough to keep those wounds right. And then we already talked about the wound vac. If any of you are curious, if you go to a website called KCI, capital KCI, they have a great, that's the company that makes the wound vacs, and they are the only company making the wound vacs. And they have a great YouTube type training thing that will show you exactly how a wound vac works. You know, it might be interesting to you. And we may actually see some when we get to the hospital. You know, the unit we're going to at Glens Falls often has them.
What was that website again?
KCI, capital KCI.
Is it .org.com?
.com, I think, but I think if you just Google KCI, it'll come up. So this is a transparent film dressing. You know, and that's not gonna provide any healing assistance. It is just going to keep anything from getting in there. So they are seldom used. I don't like them used on elderly people at all because they rip their skin off. They are not good. I have
pull
a
it off,
fit.
you're pulling all the skin with it.
Yeah, I have a fit when they use them on IV sites on little elderly people with wiggly skin. It's not a good thing.
Is there something else you can do?
Is there something else? Yeah, they're better off with just plain old tape, to tell you the truth. The rest of this about dressings, here's a picture of the wound vac. The rest of this is, we're gonna talk about in the lab.
Oh,
That's what the wound vac looks like, and there's even a new one that if there isn't enough moisture, or if we want to put antibiotic in the wound, you can infuse antibiotic into the wound, and then this will suck it back out again after it's had contact with the patient, which is rather cool. Yeah, this next slide just shows what the sponge is like. When we learned how to do these, we practiced on honeydew melons. Hollowed out a piece of the honeydew melon and packed it. Well, actually sucked the juice out. This is the example of what happens for wound vac therapy, and it really will heal wounds.
Where on the body is that?
I'm thinking abdomen.
Yeah.
I think it's a belly.
I don't know, now it kinda looks like.
How would you get a pressure ulcer there?
It looks like what? Like the bottom.
Well, this is a
like your
dehisced
butt
wound.
cheek.
Oh, okay.
This is a dehisced wound, I think. I don't think it's a,
Oh,
you know, I think this was a abdominal surgery gone wrong. Yeah, it can be used for anything. Now, I want to show you this because you don't see them very often anymore except in big belly surgeries, and they are very good. These are called Montgomery straps. It is, and this is nothing, this is just be familiar with the term, don't be crazy about it. But this is really good for a wound that has a drain in it, like one of those Penrose drains I told you make you crazy because you're changing it all the time. It has ties. It's very much like the laces on your sneakers. There's an adhesive side of it, and then the other side has holes in it, okay? So you put some skin barrier down on the patient's skin so you don't ruin it with the adhesive. You attach a piece to either side of their wound, and then you can change the dressing without having to rip tape on and off all the time, okay? And so what you do is you put your dressing down, and then you just put this over, and you lace up the ties, okay? And that will hold the dressing in place so that, you know, the next time you need to change it, you just undo the ties and change the dressing. They are very helpful. We have lots of other things now, though. We have stockinette panties, we have stockinette tubes that you can do, all sorts of things, so you don't have to put tape on a patient, which isn't a good thing. Cleaning the skin, and this we're going to do in lab. Just an example of how to clean the drain site, how to remove staples. Oh, you'll get to do that sometime, that's fun. Different types of sutures.
Nurses get to remove staples?
Nurses do sometimes get to remove staples.
I removed my own at one time. They gave me the little thing, you take my
Yep.
own and set them right out yourself.
Okay, Postcard patient arrives at the ambulatory care center and states, "I'm not feeling good upon assessment. You note an elevated temperature, an indication that the wound is infected